Mahalo. I'm Dr. Sean Delaney with Kalani Total Health Center. Did you know that knee pain affects about 1/3 of the population in the United States every year? Did you also know that the knee is what we consider a weight-bearing joint? And that's very important to understand because your body weight and some of the activities you're doing increases or decreases the amount of pressure being applied to the knee. Let's just take your body weight. Every pound of your body weight, the amount of stress being applied to your knee is 4 times that amount. So let's just say I weigh 200 pounds. That means every step I take is 800 pounds of pressure being applied to my knee joint. This is why if I'm overweight and I have knee pain, it is important. One of the best things you can do for yourself is to lose some weight. So if you were to lose 10 pounds, that's 40 pounds of pressure right off your knee joint. And just as a side note, it's 6 pounds of pressure off your hip, which is another weight-bearing joint. So you figure your hip is 6 times your body weight stress, your knee is 4 times whatever your body weight of stress being applied to your knee with every step you're taking. Another interesting factor, since we're talking about load on the knee, is the stress that's applied to your kneecap when you are going downstairs. A lot of people report when they have knee pain, the pain increases when they try to go up or downstairs. Well, going down the stairs when you are descending, that can be up to 5 times the amount of your body weight. That could be pretty significant. So that's one of the best things you can do if you're overweight and have knee pain, is to figure out a way to lose some weight, as well as, getting it evaluated and getting on a proper treatment plan. Another thing about the knee people may not realize, and it might catch a lot of people by surprise, is that your knee cap is specific to you. That means it's just like your fingerprints, it's just like your retinas in your eye. It is what we call a biometric, which means we could identify you by your kneecap. The drawback is, or the thing about it is, nobody cuts their kneecaps out to fully figure out a way to identify somebody else, or to have it monitored, or that's not even a good term, monitor, to have it measured so therefore we could use it later, like with your teeth or with your fingerprint. It's a little bit more accessible. Another thing about knees that people may not realize is if you're diabetic, in general, being diabetic is going to increase your risk of injury because of the way the body responds to things. But when you have type 2 diabetes, that makes you more likely, like 2 times more likely, to develop osteoarthritis, which is when the bone starts to change shape and you get a breakdown of the cartilage that kind of cushions the joint. So therefore, every time you do an activity or you take steps or you walk, in this case, dealing with the knee, it's going to increase that pain and that pressure. So that's something else we want to monitor and be on top of. And one of the biggest things that people may not even realize is the shoes you're wearing. Wearing the wrong shoes can increase the pressure on your kneecap because you're wearing shoes that are worn out, shoes that weren't designed for the activity you're doing, or shoes that just weren't made for the type of foot you have. When a lot of times you see this in runners, they just buy a shoe off the shelf, go out and start running, and they start having pain because the shoe is forcing them to overpronate, which is increasing the stress on the inside part of your knee. Who knows? Let me say, who knows why or what without being evaluated? The average person just, we just buy things and we like them and we just go use them, and we don't even attribute that as the reason for the problems that we're having. Give us a call, come in for an appointment. Let us help you figure out why you're having knee pain, and let's figure out a treatment plan to get you out of pain. Once again, I'm Dr. Sean Delaney with Kalani Total Health Center, your one-stop holistic health shop. Mahalo.